I've trained some of the PhD students and research fellows which work in that system, and they've adopted some of our technologies into that, and we're now talking about how we can put those technologies more directly into their systems. Here's the problem, is that they get funding to do that because, for example, the Horizon 2020 funding system has a theme called Computational Modelling and Simulation for Health. So that's where you get biomedical engineering, computational modelling and simulation, and apply that to health problems. It's actually a funding stream that you can apply for. There is nothing like that in Australia whatsoever. We're happy to do the clinical research or the very developmental science and engineering, but nothing in the middle where you're actually taking those technologies and creating new technologies that you can inject into the clinical pathway. We miss that middle gap. And Europe and the US, they have funding streams to do that. We don't have that in Australia. And that's a frustration.
One of the things that we could do to get there faster is have more companies, more technologies online and aware of disabilities. That's, I think, is the biggest push. You're seeing it now with companies like Microsoft, Facebook, and Google and Apple. But I think as we start to grow technologies even in spaces like Wi-Fi, when you're talking about 5 gig Wi-Fi networks, if we start thinking about how those technologies could improve disabilities or persons with disabilities in their lives, I think that's kind of how we get there. So people pushing and pulling on the same page and aware of the disabilities that are out there and how they can improve it.
I think funding is always a big challenge, but I think there also needs to be a closer relationship between the clinical community, the research community, and the innovators working in the space.
I would see the most important step as being strengthening the links, and I think this is really a continuum from very fundamental technology and computer science and other biomedical engineering and fundamental neuroscience, all the way over to patients and parents and families. And that along that continuum, I think there's a gap, and it's to be filled by clinicians who want to learn about this technology because they understand the patients and need to bridge the tech and the science world with the patients and the families. The clinicians in the middle can learn from both sides, so they need to engage the families to hear what the families want and what they need, but then they can reach across, and if they understand at least a bit about the technology, they can bring the technology towards the patients. Otherwise, technology may just grow in a million directions. I'd like to pull it towards the patients, I think, is what's essential.